Across Europe, there are many children living with rare and potentially life-limiting diseases of the brain, nerves and muscle. Although individually rare, collectively these conditions are common. The European Paediatric Neurology Society plays an important role in training and research so that child neurologists can help children like Victoria, who has a rare genetic condition. Julie MacDonald reports from the Evelina Hospital in London.
Out of surgery and back in her parents' arms, 2.5-year-old Victoria has just become the youngest patient in the world to undergo deep brain stimulation at the Evelina London Children's Hospital. Victoria has a rare mutation in the GNAO1 gene, causing a vicious cycle of severe continuous dystonia, severely limiting her quality of life, her development, and requiring extended stays in ICU. Initially a patient in Glasgow, where her parents live, Victoria wasn't developing typically and returned from holiday with episodes of uncontrolled movement, which saw her admitted to intensive care. The team in Glasgow, including Professor Samir Zubairi, began to suspect that she may have a movement disorder.
Her condition deteriorated. She started having lots of excessive movements, and these movements were completely uncontrolled. So her arms would flail out, her legs would flail out, her face would twitch, and this would happen almost continuously. And in the end, this stopped her from being able to feed, and it impacted on her breathing. So this is like she's running a marathon continuously. So we thought she might have a very rare genetic movement disorder called GNAO1 related disease. So this is a condition which sometimes gets mistaken for epilepsy. This condition GNAO1 is rare, but it can be tested for through a genetic test. And we found that she had a significant change in the GNAO1 gene. We tested her parents and they don't have the change. So what this means is this was a new mutation in her genetic makeup.
For her parents, Martin and Patricia, it's been a long journey to diagnosis for their daughter. And today, post-operation, it's potentially another step towards a better quality of life for Victoria.
We've been happy that she's awake and that operation is done.
2 years without any news, it's very heartbreaking, and she's suffering all the time, and no developing, normal like baby, crying a lot. And we will see after this operation how she's gonna cope with this stimulator. And the stimulator hopefully gonna help her for her movements. And
working with consultants at the Evelina London Children's Hospital, where deep brain stimulation has been performed successfully on older children, Victoria's parents were told she too might benefit.
So now the alignment of that arm is along the axis of entry from the skull and then through the brain to the target. Dr.
Jean-Pierre led Victoria's treatment.
We have done 4 cases with the same condition, 2 other cases a bit like Victoria, and 2 other cases much older children. So as soon as I realised that actually there is a man-made system that can change the course of these conditions, often very dramatically, it's a big can-do effect. So the next thing is really, how do you actually deliver this in children? How do you make it viable? The multidisciplinary team that are working entirely on the needs of children with movement disorders has meant that we've created a real momentum to begin to explore not just how children respond to a surgical process, but what is it about brain function that can respond to these processes.
In the operating theatre, Jean-Pierre and his team, surgeons Richard and Haru, are benefiting from supportive technology, but pushing the boundaries of paediatric neurology is no easy task.
Victoria was the youngest that we've done, and as far as I know, the youngest in the world ever for this procedure. That opens up a whole series of difficulties. So simple things that we don't think about in adults, like does the adult size equipment work with someone so small? the thickness of the skull, the thickness of the scalp, the size of the implant, which is quite large. Victoria will grow. As she grows, the electrodes we put in won't be in the ideal place. And we've set it up in advance that we can advance it with a minimum of effort in the future to optimize the position of the electrodes. Things like that are developing, and as the manufacturers get used to the fact that we're dealing with younger and younger children, so the devices will follow.
For the European Paediatric Neurology Society, continuing to push the boundaries of treatment for children, offering patients like Victoria options beyond symptom management, is vital.
In the past, paediatric neurology has been very much about making diagnoses and symptom management. And I think within the next 10, 20 years, we're going to see a massive shift in terms of actually being able to focus our attention on altering disease course by actually altering the genetic mechanisms of these diseases. We're really committed to developing education for young trainee paediatric neurologists. So physicians from throughout Europe are welcome to come to these courses, and we extend bursaries and scholarships to facilitate perhaps physicians coming from countries where the income is less. Research is another big area that we're involved in, and again, very much focused on encouraging young new researchers to get established and start off so they can become the leaders in our profession.